So I ask you, on behalf of Erin Gabriel and lots of other families and the worries that they have that the Medicaid cut will hurt their family and the changes to Medicaid expansion, the 17 million who are covered by Medicaid expansion, many of them with an opioid or addiction problem. How do you, number one question is, how do you justify those cuts? And number two, can you guarantee Erin Gabriel's children, or guarantee Erin, that her children will never lose their coverage under Medicaid as long as you're the Secretary of Health and Human Services?
Well, obviously, any changes to Medicaid are going to have to be done on a bipartisan basis, given the makeup of both houses of Congress. And so these are proposals that we think actually fix some of the poor incentives for children in our system. You know, the Medicaid expansion created a very perverse financial incentives for states to focus on able-bodied adults over the traditional children, aged, blind, disabled, and pregnant women in those programs. And so part of our budget is a focus on actually how do you restore the focus there and make sure Medicaid is there for them.
But just answer the question about the children. Will they lose coverage? Those three children that have autism, will they lose coverage?
There's nothing in our budget that proposes to change the mandatory eligibility categories of traditional Medicaid.
I just hope you could at least guarantee that 3 kids with autism will never lose coverage as long as you have power. Thank you, Mr. Chairman.